Today I'm going to just talk about Screwy Sight in our series on strange sensations. Probably about 50% of the patients that I see have just very unusual things going on with their eyesight. I just printed off a couple of the patients that I consulted on today. So the first case was the patient is actually contacting me, which was unusual. They've only had the problem for about 6 weeks. On one day, they did a very hard workout. They had some dental work, and then later in the day, they had a high velocity chiropractic manipulation, which after that, they had terrible dizziness, brain fog, ringing in the ears, numb sensation in their head. In the last 6 weeks, they've seen every doctor in town. Everybody thinks that the person's nuts, then when he's in a store, he feels like he's on a boat, like the vision, everything gets kind of blurry. He knows that his vision just isn't normal. He always had 20/20 vision. It's almost as if I'm not even there. Like I'm looking around, but I'm not comprehending literally what I'm seeing. Then the second patient, her particular problem has gone on for about 10 years. Heart palpitations, difficulty swallowing and breathing, diarrhea, numbness in the arm, numbness in the face, sweating, panic attacks, feeling of impending doom, constant feeling of electricity running throughout the whole body, brain fog, disorientation, memory loss, bowel issues, difficulty swallowing, anxiety attacks, tightness in the throat, sensitivity to light and sound. And then in the past year, they've started to see an optometrist because the vision was deteriorating. The vision is always very fuzzy. It's blurry. It's getting worse. They were prescribed glasses. That didn't help. They noticed weird behavior in the eyes. Like in other words, when they look at something, they lock onto it. But then when they look away, that image is still there. And then also sometimes they can't control how to move their eyes. So again, I just want to do this video just to try to explain some of these weird things, the screwy things that happen to the sight. So I'm going to show you what's called Pupillary Hippos. This is something that you can check at home. So things to check at home are, is one pupil a different diameter? That's one. Shine a light. Does the pupil constrict like the other side? Sometimes you can see that one side, the pupil is bigger. And watch this. You'll see that this particular person has pupillary hippos where they can't control the diameter of their pupil. So watch this. It'll go down, it'll go up. See how it's by itself. See how it's going down, it's going up. The pupillary hippos means that the muscles that control the pupil diameter, the sphincter and the dilator. The dilator is superior cervical sympathetic ganglion. The constrictor is from cranial nerve 3, that the coordination of those two isn't good. That's normally because the person has a problem with upper cervical instability and the vagus nerve input into those two isn't good. So ways that we assess the eye in the office is we do optic nerve sheath. So you can see on this, the optic nerve is swollen. So in other words, the eye nerve that allows you to see is swollen. That normally occurs because they have increased intracranial pressure, because of blockage of cerebral spinal fluid flow, because of upper cervical instability, or what I term cervical destructure. And the treatment of those things, of course, are curve correction and prolotherapy to the upper cervical spine. This is me. This was recently. I have new onset flashing of my right eye, so I'm under the care of a retinal specialist. And I personally went to this great clinic in Southwest Florida called Caring Medical. This person is Kathy, and she's actually checking my intraocular pressure. The normal intraocular pressure is 15. Mine were within normal limits. And then you could just see her, see how then the computer gives a readout of what my intraocular pressure is. And my shirt says my joints don't work, and that's on behalf of Ehlers-Danlos syndrome. So we all should support the Ehlers-Danlos societies and get the word out, because there's a lot more people that have Ehlers-Danlos syndrome than is known. These are all the effects on the eye when you have vagus nerve degeneration. You can get diminished blood flow, exaggerated pupillary hippos, which I showed you. You can hampered accommodation, like you can't focus really good. So if you're noticing like you can't focus, you can't read as good, you can't comprehend as good. At nighttime or at dusk when you're driving, like the lights are blurrier. These are all signs of you could have vagus nerve impulses blocked that affect the eye, and also you could have upper cervical instability by other mechanisms affecting the eye. You can have increased intraocular pressure. You can also have decreased intraocular pressure. You can have limited pupillary constriction, so then you get light sensitivity, and then you can have optic nerve damage, and you can have poor image quality. So if you feel like the visual fields, like they're getting narrower and narrower, like there's a darkness on a certain part of the visual field, if the image quality is poor, or you feel like you're on a boat and you have Barkman syndrome, where it's like you're on a boat and you can't focus your vision, then you should get an assessment for a neck problem affecting your eyes. This just shows that cervical instability can block cerebral spinal fluid flow. Once it blocks cerebral spinal fluid flow, you can get what's called eye squishing. So in this thing, I titled this figure "The Squish, the Kink, and the Yank from Cervical Destructure," and that can, of course, affect the eye. You can get squishing of the eye. We can actually see this on ultrasound or MRI. It can cause swelling of the optic nerve sheath. And then, of course, the kinking of the artery can affect the blood supply to the parts of the brain that let you see. Then this just shows, instead of there being, see how it's flattened, see how the eye there is flattened, so you can actually get squishing of the eye. This is a cross section of an MRI. You can actually see on MRI that your eye is getting squished. If the eye is getting squished, then obviously the image quality isn't going to be very good. Some people have pulsating vision. This was from a patient. While driving, I noticed prisms in one eye. Then I started having pulsating spots in my vision. When driving, I started to have spatial issues where it felt like other cars were closing in on me. I had blurry vision, double vision, seeing light crystals that flicker constantly. I also had ghosted images that will follow me when I look away, like the image I just looked at was still there. Now, obviously, like me, I did go to see a retinal specialist. The retinal specialist didn't have answers to why, when I turned my head to the left, I got lightning like bolts in the right part of my eye. So I chose to go to Caring Medical Florida, heard it was a good place, and I'm under their care now. So just know, if you have screwy visual things, screwy things that no optometrist, no neuro-ophthalmologist, retinal specialist can figure out, I'd really recommend you come and see us. We would do a digital motion x-ray. The team at Caring Medical would assess you by the mechanisms that I said. And if we find cervical destructure, changes in your cervical curve, we'd recommend curve correction. And if instability is found, then obviously we'd do a course of prolotherapy, which works very good for this. And often vision starts improving right away. That's the normal. We get a lot of people's vision back to very good sight. 20/20 is obviously what we're going for. And if we do that, you're going to be happy, and so are we. Thank you so much for watching.